But first tonight, the U.S. Supreme Court's monumental ruling on health care.
Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it.
What the court did not do on its last day in session, I will do on my first day if elected President of the United States.
Today's decision affects nearly every one of us. So what is next? In 2014, almost everyone will be required to get health insurance or pay a fine. Most employers will face fines if they don't offer coverage to their employees. There will be help for those who can't afford it, and Medicaid will be expanded to cover more people. Insurers will not be allowed to deny coverage to you if you have pre-existing medical problems. Our team coverage begins with 24-hour News 8's Danny Carlson. We wanted to see the face of West Michigan's uninsured out there to find out how that ruling will impact them.
Yeah, Brian, we found out today that about 15 to 21% of the people in every single West Michigan county are currently uninsured. Now today, as you mentioned, we got a chance to speak with a few of Kent County's about 65,000. The overwhelming majority of the people that we spoke to were in favor of today's ruling, but not everybody was. Some of the thousands of Michigan's and Kent County's uninsured are also unemployed, many for the first time in years.
Much to my surprise, we fell through cracks that I never realized existed. And
others have jobs but say their employers don't provide health care, and they say they just can't afford it.
If I have to choose between my kids eating and insurance, we're probably going to feed the kids.
According to the state, more than 1.3 million Michiganders are uninsured. More than half of them are the poor or the working poor. And the biggest single group of uninsured may be surprising. It's young people. Nearly a quarter of 18 to 24-year-olds in Michigan don't have health care coverage.
I hurt my ankle there.
The overwhelming majority of uninsured people we spoke to in different parts of the city celebrated today's decision.
this phenomenal, seminal moment in history where we're finally going to make sure that we don't turn our back on our fellow citizens.
But some still think it's a bad idea. Those like Bob Galbraith. Even though he isn't totally uninsured, he does have a $10,000 deductible.
I consider that I have catastrophic health insurance, so from the day-to-day colds and sicknesses, no, we purchase that directly out of pocket.
He says even if it would be financially better for him, he still disagrees with the plan on principle.
I think it's wrong. I think it's inappropriate for the government to force an individual to purchase anything, and then if I don't, penalize me for that. So I think it's beyond the scope of what reasonable government should be.
Some of the people we spoke to today said that they would be happy to pay for their insurance coverage, but just at a more reasonable rate and not at the very high, what they say, the very high prices that they're seeing right now. Now, also, if you want to see how your county stacks up in terms of the number of uninsured, we will have more information about that on our website, woodtv.com. Live in Grand Rapids tonight, Danny Carlson, 24-hour News 8.
The policy surrounding health care reform is a question of hot debate. The politics of all this may have some real impact on this year's election. And 24-hour News 8's political reporter Rick Alvin is here right now with more on that. Rick?
Susan, for President Obama, the Supreme Court offered vindication of his marquee legislation. For Republicans, a ready-made campaign issue that they believe will help them in November. How voters factor in all of this into their decision this fall is impossible to know, but what we do know is both sides will be spinning it quite differently for the next 4 months. We heard from the president and a West Michigan congressman earlier today.
If you're sick, you'll finally have the same chance to get quality, affordable health care as everyone else. And if you can't afford the premiums, you'll receive a credit that helps pay for it.
Anytime we see a massive tax increase like this on the economy, of course it's going to hurt any of our recovery. It's going to hurt our economic standings.
Now, there are 2 or 3 major unknowns as it pertains to the election. Will a significant number of people find this reason to vote for the president? Though the legislative and judicial victory for Mr. Obama, large portions of the plan have not been implemented, so many people just don't know how it's going to affect them. On the other hand, will people who oppose the law be motivated to go to the polls to try to undo it at the ballot box? And finally, we're more than 4 months away from the election. And who knows what intervening issues may capture the headlines between now and then that could make health care reform take a back seat. We, of course, will be watching all of this very closely. Susan?
Rick, thank you. What is the next step in our state? Governor Rick Snyder says that he is pushing for an online database where people without insurance can comparison shop, if you will, for private health insurance. Snyder says that he doesn't agree with the Supreme Court's decision, but says this database will be crucial in making the new health care law work in our state. He hopes to have that website running by 2014.